thank you everybody for having us. I'm so sorry that we could not be there in person. Madison and I so badly, and I wish that we could make it. But thank you all for joining us today, and thank you everybody for this opportunity. Really appreciate it. Madison and I will talk a little bit about Cancer Treatment Centers of America, and then Dr. Kelman will also present on the integrative side of CTCA. So we wanted to make sure that we approached it from both angles today. So CTCA is one of the premier oncology organizations in the U.S. We have 3 hospitals throughout the U.S., and our singular focus is on delivering the patient-centric, comprehensive cancer care that we can offer. So this is one that's very, very focused on the patient. You'll see on the next slide what we mean by that. But each of these services are different service lines that we offer at CTCA. What we try to do is we make sure that we are able to offer the clinical side as well as supportive therapies to make sure that we're able to help the whole person. And you see some of those here below. You see the education, you see the diagnostics, the supportive care, the clinical trials, precision medicine, virtual treatment options, palliative and hospice support, and then survivorship programs as well. This is all part of our commitment to helping the patient and taking as much stress off their plate as possible. We know going through cancer is an incredibly difficult journey. We want to try to make sure that we can make that as easy as possible, given everything that's going on. So CTCA was founded in 1988 by a man named Richard Stevenson. What happened was Richard's mother actually went through cancer, and as he was going through the treatment with his mother, he realized that there were a lot of things that he wanted to change, and he wished that there was a different care model that would have helped his mother out. And that started CTCA and really started off this mother standard of care that we pride ourselves on. This mother standard of care is basically each individual person who works at CTCA is going to treat the patient as if they were their own mother. This really helps emphasize that patient centricity that we talk about, where it is always and only about the patient. So our driving force are really these patients that you see and so many more. We're blessed to be able to treat patients throughout the US and throughout the world, and to have this impact for us is profound and deeply, deeply inspiring. It's very nice to see some of these faces on this page, some of which Madison and I know, and I'm sure Dr. Kelman knows as well. Some of the proudest moments of my time at CTCA are actually being able to talk to these patients and talk to everybody in these markets that we go to better understand how can we offer this care and how can we provide it in the proper way. Like I mentioned earlier, CTCA has 3 locations: Phoenix, Arizona, Chicago, Illinois, and Atlanta, Georgia. The overwhelming majority of our international patients go to Atlanta simply because it is a massive airport hub. It's easy to access, and at the same time, it's also one of our more advanced centers as well. Speaking of advanced centers, you can see our certifications there on the right. Just want to make sure that we include those as well, as we are very proud of those recognitions and very proud of those accreditations. And Madison will talk a little bit more about these as we go along. But a few to highlight are the Commission on Cancer, COPE. Each one of these is nationally and internationally recognized. Magnet is a nursing recognition. NAPVC is specific to breast cancer. Each of our hospitals is NAPVC accredited, national accreditation for programs on breast cancer. And one to mention as well is FACT, which is really geared towards stem cell. So this is one that we're very proud of. It's only at our Chicago hospital because of how truly unique this service line is. We're only able to offer it at one site, but we're working on trying to figure out if we can do that at others as well. Our clinical leadership team, as you see here, one thing again that we try to make sure is we try to make sure that we have not just a variety of perspectives at the table, but ones that are very highly recognized and come from incredible institutions. This group that you see here on the page comes from Memorial Sloan Kettering, comes from Houston MD Anderson, comes from Harvard, comes from Johns Hopkins, Cleveland Clinic. We really try to make sure that we pull the best of the best, Dr. Kelman included, as you'll hear later on. And this is just a mark of that. It's to make sure that we can not just pride ourselves on our quality of care, but also make sure that we have the right physicians to do so. Carrying on to our model of care. This is one that we'll go through gradually. And you'll be able to see that buildup of what we try to offer each of the patients that come through our doors. So to start off, the normal sort of run-of-the-mill hospital therapies and clinic therapies that you see, screening diagnostics, medical oncology, radiation oncology, surgical, radiology, pathology, palliative care, all included under one roof. But what we try to do is we try to make sure that we can add to this and help make that experience, again, as less stressful as possible and help the whole person. So we add on genetic counseling and testing. We add on interventional specialties and services, add on precision medicine and clinical trials, supportive surgery services, plastic and reconstructive surgery, which is a huge one as you're going through some of these cancer treatments, especially when it comes to breast cancer and a lot of others. We heard Dr. Mellard talk about skin cancer as well, and this is another area for that. So we try to make sure that that's available under one roof and available to every patient who walks through our doors that needs it. On top of all of that, I talked earlier about trying to make sure that we can pull a lot of the stress off the plate of the patient and help make sure that the patient is going through the journey as smoothly as possible. And this is our commitment to that. Our commitment is to making sure that we help out with transportation. We have a travel and logistics team who is dedicated to helping each and every patient schedule their flights. And in some instances, if the patient is insured, we can actually help cover those flights as well. We have telehealth options that are becoming more and more available, and COVID was quite honestly a driver of that. This is one that is still developing and it's case by case. But we're also able to offer on-site salon, spiritual support, a cancer fighters group that helps be a support group as people are going through cancer and their loved ones are going through it as well. We want to make sure that we're not ignoring the fact that this is very difficult on the caregivers as well. A retail pharmacy on-site guest accommodations, and culinary, which I'm going to harp on for a little bit because it is not normal hospital food. It is food where we have police departments, fire departments, general public coming in because we have a pizza oven in our Phoenix hospital and I believe in our Georgia hospital too. So we try to make sure that we're not just caring for the patient, but we're also able to offer that nutritional support as well in order to help keep the patient strong and also offer just good food to help keep the patient going. I remember when I first started at CTCA, I made the mistake of going and getting a smoothie and thinking it would be a normal smoothie. Unfortunately, that smoothie was packed with protein. I did not realize it, and I felt very different the rest of the day. But again, that's our commitment to the patient, helping make sure that we're able to care for them in the proper way. So what makes CTCA unique? You've heard me mention a few of these. One is that we are only focused on cancer. It is literally the only thing that we do. There's nothing else that we do in our hospitals. We focus solely on cancer to make sure that we can provide care at one of the highest levels in the country. That mother standard of care, just making sure that each patient who comes through our doors feels welcome, feels like we're making sure that we give them the best care possible and treat them in the best way. I'm sure that we've talked a lot about bedside manner, and this is one of those important things, just making sure that we can do so in the proper way. The national presence allows us to help patients from not just all over the country, but also all over the world. Being in 3 major cities with 3 major airports, not only can we support patients' travel, but we can also support them as they're around our hospitals and make sure that they can get outside the hospital, go do some fun activities, take their mind off of what they're going through, again, because we know how stressful it is. But one thing to focus on is the care under one roof. This is not one where we have multiple locations. We're not a huge campus. We are large, but we're not forcing patients to go from one wing of a hospital, travel 300 yards or a mile and go to another building or another wing of that building altogether. I remember going through it with my grandmother, and she went to a large academic hospital in the US. And literally from medical oncology to radiation oncology, they had to put her in a bed and wheel her for what felt like an hour. In reality, it was about a half hour, but it was still going from one wing to the complete opposite side of the hospital, which just is not the way that care should be provided. So not only does CTCA make sure that we do this under one roof, but we try to minimize those travel times as much as possible to the point where we actually bring in architects to help us manage how we route patients through our hospitals to make sure that travel is as minimal as possible. Again, just to minimize that stress. And these last 2 are ones that you'll hear Madison and Dr. Kelman talk a lot about, is the integrative approach and the whole person health. Each patient's care team includes an oncologist working alongside supportive care experts. This is to help make sure that we can promote healing on all levels, the body, the mind, and the spirit. As you've heard people talk about before, we want to make sure that the spiritual and emotional support is a part of this. It's a part of what you're going through. It's a part of who you are. We want to make sure that's available to you as you go through it, especially to try to help make sure that you're comfortable, that you're going through this with the support that you need in order to have the care that you need and have it be effective. We know the impact that a positive mind can have on care, and we know the impact that that can have when used in conjunction with clinical modalities as well. At this point, I'll turn it to my colleague Madison to cover delivering the mother standard of care.
Hi, good morning, everyone. My name is Madison. I'm the manager of international business for CTCA. It's a pleasure and an honor to be able to speak to you all today. As JT mentioned, we are so sad that we can't be there in person. We miss Barbados so much, especially all of the people there. You have such an incredible population and culture, and it's always so warm and inviting. So we hope to get back there as soon as we can. There we go. Sorry, I had some clicker problems. At CTCA, we believe strongly in a team approach to our cancer care. We want patients to feel surrounded by their care team and their medical oncologists and their various providers that they see. So we have separated things into centers of excellence so that each team focuses on a specific diagnosis. So you'll see here some of our various centers of excellence that we have. We focus on breast cancer, lung and thoracic, colorectal and GI cancers, prostate, neurologic, gynecologic and pelvic, and hematologic cancers. We have seen as patients feel this team approach, they get to know their medical oncologist and the nurse practitioners and the nurses on a deep basis, that they feel more empowered in their care. We want patients to feel empowered and surrounded as they go through cancer treatment. Because of this team approach, we consistently have higher physician ratings than the national average. And as JT mentioned, how a lot of hospitals in the US are spread out into multiple buildings, and it can feel slightly disjointed in the care. We believe that our under one roof and that team approach are why our physicians rank consistently higher across the board. They know their patients, they know their names, they know their families. And it's always a beautiful thing when a patient walks into the clinic and the physician greets them by name, asks specifically how their child is, how their spouse's business trip was, or little Johnny's baseball game. And it really makes patients feel safe. They feel safe in their cancer care because their physician knows them. But we also want to rank nationally in satisfaction in our practices. And so the way that we do that, and the way that we know that we are providing consistent care, is that we are COPE certified. We are consistently evaluated for these metrics. So COPE is a nationally and growing internationally recognized quality initiative to ensure high-level quality care standards for cancer treatment in the hospital. There are standard metrics that must be met in order for COPE to make a hospital certified, and you'll see the thresholds there on the screen. We at CTCA pride ourselves on setting standards far above these thresholds and ensure our hospitals exceed those expectations set by COPE and by ASCO. This is just part of our commitment to quality care and maintaining our belief that is always and only about the patient. What also speaks to our level of care and the models that we have set up are our proven ability to drive superior outcomes. When you partner the most advanced cancer treatment methods, top physicians, and integrative care, this leads to superior outcomes. You will see that across the board, we are consistently much higher than national average, and we pride ourselves in that. We believe that this speaks to our model of care more than anything. This is what patients come to us for. They want to know that they have a higher percentage of their patient survival after 2 years. They want life. They want to go to more of little Johnny's ball games or be there for their spouses and their families. And so by providing higher care and offering higher percentages of success rates in treatment, that's the sweet spot for patients. This is always my favorite slide, and I get giddy over it when I get to speak on it. These are quotes directly from our patients. These are patients that JT and I and Dr. Kelman know personally. We've had lunch with them. We interact with them in the hallways. We talk to them in the smoothie line. And so we love seeing their quotes, the way that they describe their experience with CTCA. So I'm just going to highlight two of them that I really love. The first one is from Viola. And her says, the people at CTCA are so warm and made us feel so safe and at peace. There is simply a wonderful atmosphere of togetherness. I was amazed by the teamwork and communication between all of my doctors and clinicians. I think this speaks to how much patients value that team approach and how much they value that all of their physicians are in contact with each other as they go through treatment. All of their specialists are speaking. It's not just sending medical notes to other buildings. They're meeting in person to go over that patient's care plan and make sure everything's going to plan and that everyone's on the same page. So there's no forms of being disjointed in their care because all of their physicians are working hand in hand and in arms with the patient. The other one that I would like to highlight is Miriam's. Miriam says, my experience at CTCA was consistently empowering. And I love that word, empowering. I took full advantage of all of the integrative services. CTCA helped me transition from feeling like a victim to becoming a fighter, a survivor, and a healthcare advocate. And that is what we want everyone to feel. We want patients to feel like fighters and a survivor and a warrior against their care. And we are just part of their army. We are joining them and helping them along that way, giving them every piece of success that we can. And because we feel so strongly in that, we want to offer a concierge level of care for patients so that they never feel alone. They always feel like their army is behind them. And that means that we're always a phone call away. So we have a 24-hour care management line. That's for nurses. So if it's 3:00 in the morning and you start to get a cough or a skin rash or something like that, you can call a nurse and they can help you over the phone to maybe find over-the-counter things that you could do in the interim until you can be seen by a physician. I also do this personally with my international patients. My patients always have my WhatsApp. They know that they can reach me any day of the week, even on weekends, if they have any issues not being able to reach someone or they get at the airport or in travel, they know that I'm always there for them. And that's something that I love. I love having that kind of relationship with my patients. And because of this, because we provide that concierge level of care to patients, they are consistently satisfied in their care. We regularly speak to patients to get their feedback because we always want to improve. We want us to always be the top performing hospital and physicians and stakeholders for patients. So we constantly poll patients and ask for their feedback so that we can improve and do whatever that they need. So you'll see here across the board, we perform in the top 95th percentile of patient satisfaction in every category. We're also ranked in the top 22 patient recommended hospitals in the United States and top rated hospitals for patient experience. And that's something that we love to share because that's what truly matters. We can have organizations, large corporations evaluate us and decide, how we measure up to metrics, but it's what the patients think. That is what we care about. This is a explanation of the way that we have our patients come through our concierge channel for international. So this is all handled by myself and my team. So when an international patient reaches out to us or is referred through their physician or Cancer Support Services provides them our phone number, they are going to speak to me or my team first. They're not going to go through a call center or through a bunch of different automated press 1 for this thing or press 2 for this thing. They're coming directly to us. They're going to speak to a person first. And so that is the first step. We will meet with the patient over the phone, ask them about what's going on so that we can guide them in the best possible way. The next step is that we ask for a patient or the patient's physician to provide us with their medical records. We want to do a medical record review prior to arrival so that we may evaluate the patient and place them with the right care team, the right medical oncologist, and the potential right treatment plan ahead of time. When a patient travels to us, we want to have everything set up prior to arrival and know that we have options for that patient that are appropriate. The next part after the medical record review and we've placed the patient with their team is that we handle all of the logistics of travel. This is something that CTCA does specifically for patients that makes us stand out compared to other cancer centers, is that we handle all of the travel logistics for you. So we help book your flight, we help book your hotel. We provide ground transportation. So when you arrive at the airport, we have a driver there for you, waiting to pick you up and drive you back to the hospital or to the hotel, depending on your schedule. You also have access to those drivers while you're with us. So if you wanted to go shopping or you wanted to go out to eat, you're not stuck at the hospital. You have freedom to go these other places and feel normal and feel like it's almost like a mini vacation in some ways in between appointments. We have a lot of our international patients love to go shopping, so we want to make sure that they have access to places should they want to do that. The other part is once they arrive at CTCA, our centers know to be expecting them. They know that the international patients are coming. They greet them by name. They make sure that everything is set up for them when they arrive so that patients don't have to worry about anything. We don't want them to focus about anything else other than becoming a fighter against their cancer. So we handle all the other logistics and even things down to helping provide letters for visas or for embassies. We can help provide that kind of documentation as well. So there's no hiccups along this travel process. Should you ever need CTCA for yourself or a loved one, or if you're a physician wanting to refer a patient, JT and I are your key contacts. Here are our phone numbers, our email addresses. You can get these directly from Jan and the team at Cancer Support Services. We are always available to you. We look forward to hearing from you. We always say that we never want to hear from patients, but if they should need us, we want to be that call. We want to be able to provide that peace and guidance to help you through your cancer journey. And that's something that JT and I both find so much joy in. Thank you all so much. JT and I are so honored, like I said, to be able to speak to you today and hope to see your faces in person soon.